This morning, the confirmation of a second case of COVID-19 in South Africa. We've got the Minister of Health, Dr. Zweli Mkhize, on the line. Minister, a very good afternoon to you. Tell us more about the second case.
Well, thank you very much, Ben. We'd like to inform the public that a second person has tested positive for the COVID-19 virus. He is a 39-year-old South African located in Gauteng, and had been part of the 10 people who had traveled to Italy and came back, and he had been identified as one of the contacts that were to counsel, test, and then asked to be in self-quarantine. So at the moment, he's been restricted his movement, and we will then be following up with his admission. He's going to be admitted in the hospital sometime this afternoon. And so the others are also awaiting their results of their tests. We will be announcing the tests if they come out positive in the next few days. We also need to inform the public that we've also received a report from our embassy in South Korea that one South African, a 39-year-old who's a teacher, was working in the town of Daegu and has also tested positive for the coronavirus. We're waiting to get more details, but he's still out in Korea. In that particular area, there's been a rapid increase in the numbers of people who have got coronavirus. I think the latest was just over 7,000. And so we will also notify the public as the situation develops.
Minister, the second patient that has tested positive for COVID-19, where will the patient be admitted to? Which hospital are we talking about here?
The patient will be admitted to Charlotte Maxage, which is the government hospital in Johannesburg. And we will release more information afterwards, more details. Right now, we just wanted to make the notification to the public.
Right. Dr. Mkhize, your statement says that this is a 39-year-old female. Is it a 39-year-old male that you're telling us about?
No, I'm sorry. The 39-year-old male is in Daegu in South Korea.
All right. So the person that has been admitted to a Gauteng hospital is a female, a 39-year-old female, correct?
Yes, that's my understanding at the moment.
All right. Minister, talk to us about, you spoke about this person was part of that group that came from Italy, and you have since corrected saying that the initial person, the person that first tested positive for COVID-19 that came from Gauteng via OR Tambo, you since corrected saying that they flew via Dubai into King Shaka International Airport. Tell us about this group of 10 people. Are they currently in isolation?
Yes, we had to correct that. We're dealing with a number of persons that are coming through various airports. So the one that we confirmed in KwaZulu-Natal came from Italy via Dubai and into King Shaka International Airport and then went home. These others, we will be establishing all those details later as we release the information. But all of them have been asked to go into voluntary quarantine in their own homes, and they've all been tested, and we release the results as they get ready one by one.
So this is a second case. Can we expect more?
This one is a second case, and I would like to say to the public, unless we have released the statement, they must ignore all the WhatsApps, the Twitters, and all the stories that come from people out there. People are very concerned, and so they identify people who have not been tested sometimes and make statements about them. It's really out of concern, and I'd like to discourage people from releasing such information because it may be misleading. At the moment, this is the second South African citizen inside South Africa.
Right. You know, I guess the message, the important message here is to be very wary of misinformation. We know that disease is not the only thing that spreads. Misinformation, fake news as we know it, is also very contagious. So that's an important point. Minister, talk to us about allaying fears of South Africans. Obviously, we need to be vigilant. We need to take this serious, but still no need to panic at this stage.
We need to be calm and not allow panic to take over. it's important for us to know that there will be more cases identified in South Africa. They are increasing in every part of the world. As we speak today, we have probably about 94 countries that have got the disease identified. When it was notified about 2 months ago, there only were about 5 countries that were involved. So the number has increased in such a way that every country should expect that it will be detecting people who have got this virus. The approach to the virus is that we take very basic precautions on hygiene, washing hands, and avoiding coughing into the open place, and making sure that if anybody's got symptoms, we discuss it with the doctors, but that we will identify people and take them for treatment. There should be no panic. There should be no closing of schools. If there is anyone that is positive, we will be the first ones to know, and will actually make sure that they are traced and that we find all the contacts. We will indicate when we think people should be worried or should go and stay at home. When we do so, please, we'd like people to cooperate with us.
You know, Minister, one of the things that's getting a lot of people anxious around the world we're talking about is that we don't know everything about COVID-19. We know what we know in terms of, washing our hands, cleaning surfaces. So that's an important base in order to start with. Talk to us about the difference between influenza and the difference between COVID-19, because somebody's sitting back home now that has a cough, that has a fever, and freaking out in terms of what next to do. You don't want a situation where you have thousands of people rushing to the emergency room thinking that they have COVID-19. What's your advice to somebody that is, experiencing what many would describe as flu-like symptoms?
Well, flu is always part of our lives, and it comes from different viruses. There are very different. There are several groups of virus families that affect human beings. You have a group called rotaviruses. You've got influenza group. We have got also others such as human papilloma viruses and so on. Coronavirus is a family that's really largely existed in animals and was well documented there. Now, this particular virus has actually crossed from the animal species to human species, and the result of that, we call it a zoonotic effect, which means that it causes a lot more harm to the new species because their bodies are not adjusted to it. Most of us come across influenza viruses and get flu, sniffing and coughing and cold and so on, and sore throat. But because our bodies are exposed daily to all these viruses, we tend to have antibodies that neutralize them. They become less effective and less problematic in our bodies. This one, because it's new, that's why it's called novel coronavirus. It's novel because it's new in human beings, although it has been well established in animals. So we just want to say that if the symptoms are severe, if you've got someone who's already had contact with an infected person, or is infected or comes from an infected area, then you need to just report that to the doctor when you come out and you feel that those symptoms need to be reported.
Minister, the WHO tells us that about 80% of people who contract COVID-19 recover well. People that need to be concerned are those that have these underlying conditions. We talk about heart disease, we talk about chronic lung disease, we talk about diabetes, correct?
That's correct. It is said that the people who get affected most are those who have got underlying diseases that causes immunosuppression. So if your immunity is low, this becomes an additional burden to the body, and so they tend not to do well in the way that the disease conducts itself. So people who have got underlying diabetes, immunosuppressive problems, people who are on chemotherapy with cancers and others, heart diseases and so on, could be more vulnerable. But it's important also to say that with all of that, about 10% or so of those people can be so serious as to need to be ICU. And so at the moment, because we haven't got many, we haven't seen those kinds of devastating effects. The one patient that was admitted in Pietermaritzburg. Already before he went to hospital, he was reporting that he's much better. So we should expect that many people will recover from the virus.
You know, as I was saying earlier on, we're still learning. Scientists are still learning more about COVID-19. The trajectory of this virus is at this stage still uncertain. I'm talking about globally. But in terms of what we know at this stage, it spreads via droplets, respiratory droplets. So by a person sneezing and by a person coughing, and the next person is in close proximity, that's how you catch it. Talk to us about, this compared to, say, for instance, other illnesses like measles, which lingers in the air.
We have at the moment, the cause of the infection is what we call droplet infection, which means the viral particles will come from the body through the fluid that gets thrown out in the air when somebody sneezes or coughs or talks very, forcefully. So that is a normal thing that will happen in any upper respiratory tract infection. It tends to affect people who would be about a meter or so away from the individual who's affected. So we would like to encourage people to look at the distance between those who are coughing. If it's more than 1.5 meters to 2 meters, it can't affect them. Right. Then there are other types of diseases which, like tuberculosis, where the bacteria get out and linger out in the air. We call that airborne infection, which means you can be in a room where someone is coughing, the droplet, the virus, he lingers in the air, and you inhale the air as you are sitting there for the most of the time or part of the day. It affects you even if the person is no longer in that house. Right. So there is a bit of a difference there. There are other ways of spread, like what we call the oral route, which means you got something dirty in the hands or in the food, and then it gets into the gut. So there are very different ways of getting infection. But the key is to ensure hygiene, and then when we cough, we cover our mouth and make sure that we create a distance between ourselves and those who are infected.
So once these droplets land on surfaces, Dr. Mkhize, do we know how long they can live on surfaces?
On the surfaces, it's a bit difficult to say. I think research is still going to tell us that because not much is known about this infection. However, in a human being, depending on the amount of viruses that went into the body, it can take anything from 2 days to about 14 days. There's an average that we estimate, so that during that period, someone could be then developing an infection after the exposure.
What is research saying? What is the science saying about people who contract COVID-19, they then recover? Can they get it again?
Well, it's an interesting question because we've debated that matter quite a bit. The starting point is to say that we don't know much about the virus. But secondly, most of the people who would have been infected and recovered tend to be taken back to the community. 56,000 in China are back into the normal community. But we expect that they should not be infected after that because the virus is not detected either through symptoms or through the test. And in addition, in the past few months, no evidence has been shown that this virus is mutating so fast that any immunity that the body has developed against it is no longer effective. So at the moment, the indications are that once someone is treated, they will then be free of the virus, and therefore they will not affect the individuals. But we have not seen cases of reinfection, which means that the immunity goes down again once someone has been infected. The only time will tell is that the situation. So we would just recommend that when people have been treated, they go back to the community. We can only deal with it if there are new issues arising, but our expectation is that once you are treated, you will not really be a problem. As for example, now, if you've got a family that has got someone who's infected and then the family is taken for quarantine for 14 days, if the one is treated and is improved, we'll send them back to their homes without restrictions of any quarantine. But the family will still be staying on the quarantine until the end of the 14 days. So that's the interesting part about it, because all of this is new.
Talk about close contacts of the infectious person that will be quarantined. Talk to us about the second case now, Dr. Mkhize. Did this person fly directly to Gauteng?
We will not release all of that information. We're still collecting much of that so that you don't make any mistakes again. So we will just be collecting all of that. For now, we just wanted the public to be aware.
Right.
But there's still a lot of information that will be available later. So we don't have all of those detailed information. We have not really collected all of that and put it for public.
No, I fully understand it's a fluid situation. We're learning as we go along. Let's take it a bit further then, Dr. Mkhize, and talk about air travel. We continue to travel via airplanes around the country. You know, talk to us about, my understanding with regards to what happens in the air system in an aeroplane is that it's refreshed almost every 3 minutes, right? So if a person is infected and sitting in that plane, what does WHO protocol say? Who is tested around that person?
Well, the first issue is that the droplet infection has got a limited distance at which it can cause an infection. So you would imagine that 1 meter or so would be the people on the side of the patient, of the particular patient, and those that is behind the patient and those in front. So they would estimate a few seats, maybe 2 or so seats, rows behind the patient, and those on either side of the patient. And in that way, we estimate that that's the highest level of concentration. But then everyone in that aircraft remains under observation, so that they would then be followed up in the event that we find that more people are actually needing to be tested.
So initially we had our first case of the person that came from Italy. We were told that he came in contact with about 18 other people. What happens now with the second case? In terms of the close contacts that we talk about, the people that will be tested, is the web now widened?
Yes, we will widen the net because how we work on this, the patient is at the center, then we create the concentric rings or circles outside the patient. The first group of people are those who have spent more time in close proximity with the patient. Then we will round those up and then get them tested and keep them self-quarantine for the expected number of days. And thereafter, we wait for the results. Those who are positive would be tested, and those who are not would wait for the 14 days. Then those who are further away will not be a concern until any of the contacts are tested positive. In this case, we will now take this particular patient to the center and then look around all who are around, so the families, the friends, and all the close associates. And then we will look at the places which he has visited, been to a bar, spent a long time there, been to church, and then we must then look at those who sat next to the person immediately, and then those who are in the vicinity, so that we keep a watch on all of them.
Right.
The work continues like that, and cascades from one person to the next circle. If that circle is proven to be negative, we stop the search. If the search is yielding someone positive, we make the new person who's positive the center of the search and take all the contacts around them. That's how it's done.
Right. We keep on emphasizing, Dr. Mkhize, the need for washing hands frequently, the need to clean surfaces frequently. You see this around the world, I guess, the panic buying. You see there's many stores around the world that are running out of sanitizers, and people are starting to want to stock up on masks. What's your advice to South Africans with regards to masks?
Well, firstly, the issue of sanitizers are really a mayhem. They are not mandatory. The issue is water and soap, old-fashioned water and soap. People must wash their hands when they get to the bathroom, when they've just been doing something, handling issues after, having to touch many people and so on. Make sure your hands are frequently washed, and that's the major issue. When you sneeze, when you cough, and you use your hands to cover your mouth, and you must also wash the hands. So there is the issue. The question of masks becomes a much higher level of prevention. We encourage that amongst the people who are coming across possible large numbers of possibly infective individuals. And so, like in the airports now, we've asked the staff to wear masks, and then in the hospital, we ask people to wear masks. But it doesn't really mean that, you could sit there because there's air flowing all over. Yeah. If you're a security etiquette, you don't necessarily need to be putting on a mask. You just basically need to watch the distance so that you don't sit very close to people. But because people are moving and you are there for a fraction of a second, so the exposure is not as much. And as you go along now, the fact that someone has been discovered to have the virus doesn't mean now when you walk into the airport you must all wear masks. It's only the staff that you have asked that they should wear masks. In the hospitals, not everyone in the hospital will be wearing masks. It's only the people who are nursing this particular patient that got a mandatory attire that they must use, which covers the whole body, removes all of their jewelry and their clothes and everything. They gown like they're going to theater. Then they cover their hands, their eyes, their head, their whole body. All of that is based on the level of exposure that you're looking at. I don't think we should restrict their travel. I think they must be vigilant. If they've got suspicious situation, let's get information, talk to the doctors, and let's call the toll-free lines and just get advice and so on. But it's not necessary for all South Africans to start wearing masks. No, it's not.
Yeah, I guess you don't want to have a situation where you have this panic buying of masks and you leave the medical personnel who are dealing with COVID-19 cases exposed. Minister, are you going to brief the nation today? Are you having a press briefing later today to tell us more about the second case?
There will be no briefing right now. We just want to send a message for notification, and then we're waiting for a few more results. We'll probably have a much more comprehensive briefing, probably on Monday, when we'll be able to see what the other results are showing.
All right, Minister, we do appreciate you coming in and clarifying certain issues. And no doubt we will be touching base with you in the near future to get more on this latest story, our breaking news this morning, that the confirmation of a second case of COVID-19 in South Africa. Flo will have much more up next. Quick break, more news next.